Hello and welcome to the takeaway on WDLive. My name is Justice Baidoo, and what a week it's been. Finally, it's the last day here at the Women Deliver 2019, and this is probably going to be the session that I'm going to enjoy the most because it is the time when I get to talk to people like myself, journalists. My name is Justice Baidoo, and for the next 30 minutes, I'll be having a chat with fellow journalists who have been here all through the week working at the Women Deliver conference. I have with me Thembisa Fakude from Al Jazeera, Kumba Kpakima from Sky News in the UK, and Laura Friedmann, filmmaker here in Canada. I also have Naveen Rao, who is also joining us for this conversation. Welcome
Thank
to
you.
you, everybody. And what a week it's been. First of all, to you, Thembisa, how has it been for you all week? Tell me, how would you describe the week that we've had so far?
Well, it's been a good week, educational, and also meeting different people. But I think importantly for me was to see the emergence of a new movement,
Right.
which is multicultural, non-racial, led by young people by and large. So it's been fascinating, and also the kind of transformation of the lingua franca, how people speak now.
Yeah.
And that process is also driven by young people. For example, we are now in a place called Fueling Station. And I think Naveen and I will call it an exhibition center, but it's now called the Fueling Station. So it's been fascinating. It's been a
Yeah.
great week, yeah,
Yeah.
of education.
Yeah. And talking about languages, I've been fascinated about how people in Canada combine using English and French at the same time, listening to Prime Minister Justin Trudeau. It was amazing. To you, Laura,
Yeah.
how has the week been for you, and what have you been doing?
It's been really inspiring.
Mm.
Many times we're out there doing our own work separately, but to come to a space where there's thousands of people who are working for the same cause is just re-energizing.
8,000
Yeah,
people.
it's re-energizing.
Yeah.
It's very hopeful. I there was I really like seeing that there's women and men here, and that really stood out for me. That it's both women and men who are here working together to advance the cause of gender equality. Yeah, so it's attending a lot of sessions. I wish you could attend. There's so many.
Everything, yeah. Yeah, yeah. Good, good, good.
Yeah.
Kumba, what have you been up to?
Uh, I've mainly just been attending the youth zone seminars and sitting in with the youth and hearing the stories of the young women across the world. And I would say this week has been very empowering for me. I think as a journalist, you're often in your own bubble, as you said, like you're working on your own stories and you can't really pay attention to what is happening outside of the UK. But being here, I've been able to understand stories of different women across the world, and it's been really empowering for me.
Right. It's amazing. And now, Dr. Naveen Rao is director of health at the Rockefeller Center. It's obviously has been quite a week for you as well. Sure.
It has, and I'm echoing everyone's mood here. Optimism. It's been a long week, tiring, but actually re-energized. That's the feeling I'm getting from everyone, and I echo that too. So yes,
Right.
it's been a long,
Right.
fulfilling
And
week.
and for me myself, I absolutely did not expect to have such an packed week. I thought I was just coming here, listening to people, learn as much as I could. But then I've been involved in many things, including hosting these sessions, but then also engaging with a lot of young people. And it's amazing the sort of brilliant ideas that young people are now having. The future is certainly bright. Now, Thembisa, I was on the panel with you the last time, speaking with another young person where we were talking about the future and how it is going to be like and how it's going to be shaped. You have just also said that there are a lot of young people here sort of are very poised about the future and all of that. What do you think needs to be done with all of the talk that we've had here? What are your takeaway points that we need to put in place as young people, especially people who want the change that we are being
But I don't think
talking
the conference was meant to have to impact change immediately, but it's a platform from which we can take inspiration
about?
back to our environments. Uh, but you mentioned the discussion or the roundtable we had.
Yeah.
I also like to caution about this youth over enthusiasm, and this is a discussion we had
Yeah.
of wanting to replace the older youth. So the new youth want to replace the older youth, and what we talked about, and I saw this happening here. It's positive,
Yeah.
but it has to be managed properly because I think we need to talk more partnership than replacement. Because I'm sure Naveen will know that given the health innovations, we're most likely to live longer. So what's going to happen to people like us who want to live longer and still continue participating? Are we going to be replaced? And what will happen to different public passes in terms of provision of social assistance? And I think the young people need to think about that. That we can't afford to retire certain people who are still capable of participating and remain active within um our economies or from wherever we come from, because that will also, impact on their future and careers. So this is the discussion we had with, I think it was Natasha,
Yep.
a very energetic young
Yeah.
girl who,
Yeah.
you know,
Huge.
so
Huge.
yeah. So for me, I
She's
was
a
saying,
celebrity in Ghana now.
yeah. So I was saying, like, let us be careful of that while we're doing it. Let us also talk about partnerships in terms of the replacement of the current activists. We need to look at how we can partner because we are not going anywhere
Yeah.
for the next at least 50, 60 years.
Now, Kumba, you spoke earlier about how being a journalist, sometimes you are living in your own small bubble, and until you go out, you don't know what is happening. Is there anything that you've heard or learned about this week that would challenge your journalism moving on?
Yeah, I think mainly hearing the stories of a lot of the young girls who have overcome like great battles, a lot of the young girls who have overcome things like being victims of like FGM, and a lot of them growing up in environments where they have to trek long miles to get to school to even drink water. Things like that, it opens up your eyes, and I feel like that is something I'll be taking back, especially with the stories I'll be reporting on now. Having a more gender equality perspective, adding that to my stories, and also paying attention to what other women across the world could be facing. And being here, one thing I've realized is that what is happening in the UK and what is happening like in the States is also happening in Ghana, is also happening in Kenya. So it's something that everyone across the world can relate to, and I feel like that's something I'll be taking back and using in my stories from now on.
And I would ask the same thing of you, Laura. Is there anything, you're a filmmaker, I know you document stories all around the world. Is there anything that you've learned or heard of this week that sort of pins you and makes you want to think of a new perspective of storytelling, journalism, everything?
I think something that I've taken away just as I said earlier, by seeing men and women here working together, that's something that really interests me. And I think it's the quality that we put behind the work that we're doing, whatever field it is. So in terms of filmmaking, it's about telling important stories, but I think it's also about how you do it and the attitude with which you do it. So for me, it's about prosperity for all and advancing all of us. And that needs to be done with the objective of unity. And I think that for unity to exist, there needs to be justice. And so I'm getting somewhere, but and that justice requires universal participation, and that's something that I've seen here, is in order for us to get that equality, we need this universal participation of both genders and all of the socioeconomic backgrounds and all that. So when we take on these projects, both in the stories that I tell or in the way that I do my work or build my teams, it's about ensuring that there's this universal participation, because it's not about swinging the pendulum and making it now all women, only youth, as you were saying, or only. It really requires that participation of all for it to be true prosperity, I think.
Right. And for me as a person, one of the things that I've been fascinated about is how openly people are speaking about sexuality over the last couple of days. I mean, I come from Ghana, which is a really conservative society. where people do not talk about sex. Parents rarely talk about sex with their children, and people, especially people in the LGBTQ community, because we have strict laws around LGBTQ. It's difficult for people to speak about subjects like that. But over the last few days, I've had seen many people speaking about it, and yeah, and it sort of pricked me. And I think moving on, it's going to challenge a few of my journalistic ideas going forward. But Dr. Naveen, you come from civil society. I mean, big organization like Rockefeller, and there's been many organizations like yours here this week. What is going to be your takeaway point? What are you taking away from here?
So what I'm taking away from here is a very strong sense of optimism. I'm seeing the glass is half full. And the reason I'm optimistic, apart from the fact that they are more youth and there is such a focus on gender and a positive vibration, I'm also taking away the opportunity to include data and data science advancements that are happening at so many parts of the world, whether it be in the transportation, the finance, the education, music. Every industry has been disrupted by data and digital. And I think the time has come in my lifetime to see in public health, and that is my focus. Community health, public health, the vulnerable, the disenfranchised. How can we bring the best and brightest advancements of data and data technology to leapfrog
Right.
infrastructure barriers, to bridge gaps, to bridge inequities? And data is such a strong tool. I'm feeling optimistic, I'm feeling positive, but it's just that we need to be careful that this public good of what data can do for health doesn't bypass the poor and the vulnerable, and that again, it's not just built for the rich and the business models allow it only to serve a few. We need to make sure that everyone is partakes in that. But I'm feeling optimistic of because I see it has been done in so many other industries. It's time for health, public
Right.
health, community health to be disrupted.
Right. It's interesting that you raised this point because I was also coming to that. That there's so many people. I mean, more than 8,000 people from different parts of the world, all with different ideas. Some of which I've just spoken with a couple of social entrepreneurs who won the pitch for their ideas to be supported, and amazing ideas. People who want to have ideas that would address. Human rights, people, food in Kenya, and many parts of West Africa. How, Thembisa, and this is for you because I know how you speak about getting young people and old people to work together. How can we marry everything? Because we have so many things happening, and obviously we all have one common goal: is to make the world better for all of us. How can we marry everything together?
I think inclusivity is key, but there's also in any marriage or partnership, there should be some kind of acknowledgement of skill and unique potential in partnership. So you must know what your partner possess or how your partner can contribute positively towards the prosperity you yearn for. And I think sometimes what young people tend to do is, I was the same, by the way, when I was younger. There is that tendency of thinking that old is out of fashion, outdated,
Yeah.
and not relevant. So for this new partnership to succeed, we need to realize that all of us are bringing into the table uh, something that will be of benefit uh, to this common cause that we're all trying to pursue. And I see that happening, by the way. I've seen it. I've been interacting with a lot of young people here, and I think after our conversation, many of them are realizing that they do need old youth participation. We can't just be retired and be replaced. So that, for me, the key takeaway will be that the partnership. I think it's key and very important.
Right, right. So and you have a lot of people from different places, different beliefs, obviously different religions coming from different races and all of that. How did you feel interacting and working with all of these people? I mean, learning from all of these people over the last couple of days.
I think that anything that is new, even if it makes you uncomfortable, is important. So obviously, it's a very diverse place, and I think This is this is kind of a place where you're preaching to the choir. Like everybody here already believes in these things, and they're already actively working in this space. So you just learn so many new things. But I think the important thing is to take that spirit with us afterwards, outside, in those difficult and challenging spaces where that kind of openness or that kind of inclusivity doesn't exist. Because these are the things that can kind of spark the fire for other people, right? And it's hard to do that. It's uncomfortable, especially in these spaces where all of these people, 8,000 people, activists, which I think are here working for, it's very challenging to do that. So it's good to rejoice in all of this, but I think our task is to take that spirit with us and introduce that in the harder spaces, in the more challenging spaces where there's not that openness.
Okay. Right, Kumba. Is there anything that you are taking away in terms of the sort of people that you interacted with? And
I think one thing I'll definitely be taking away is because I mainly focus on like youth stories as a young person myself, and seeing the power of all the other young people here. I feel like what I'll be taking away is this drive in my stories to show young people that there is no barriers and there is no boundaries and nothing can stop you. A lot of the young activists here, they've overcome such great battles and they're still fighting. So that's something I'll really be taking, even within myself as well. Whatever challenges come my way, I know that, okay, I'll remember what I've seen here and I know that I can overcome it.
right. So we will be going to have a look at a clip from yesterday, which is an award that was given to Dr. Naveen Rao, who has joined us on today's panel here. But before we go to that, tell me about receiving that award. How was it like for you?
So when I first found out, it came as a shock because in my mind, lifetime achievement awards are given at the end of a lifetime.
Of that
story.
lifetime.
And I feel I've just begun. So I kind of looked. I said, but having said that, jokes apart, it felt really special because finally working towards the underprivileged, vulnerable woman and the girl child, preventing maternal mortality, preventable maternal mortality, child mortality, things we should have had in the past. We should have been beyond this hundreds of years ago. Now, and the fact that we're still talking about it, and in some countries it's getting worse, it's just very disheartening. And so there are times when you stop and you celebrate and you receive this award. So I have received it, but I've accepted in the spirit that I'm just the steward, I'm just the vehicle, but it's for all the work that's being done and all the recognition that's happening that this has to stop. Maternal mortality has to stop. Child mortality has to stop. And so it feels good.
Right, and it's interesting that you talk about maternal mortality because as a journalist in Ghana, a country that is also still struggling with issues of like maternal mortality, I've done a lot of stories on women who have died needlessly only because they wanted to give birth, and it's good that people like you are at the forefront working towards. What has been your biggest challenge in this field? Working against on some of these issues? What
Biggest challenge, to answer that question, I'll quote Dr. Mohammed Fatala, an Egyptian gynecologist who was the first one to have brought maternal mortality and all to the stage almost 40 years ago. His quote is still very, very salient, and I live by it. He says, and I'm paraphrasing him, that women are dying not because we don't know how to save them. They're dying because we as a society have yet to decide they're worth saving.
Right, that's very powerful.
That is the challenge.
That's very powerful. And it's really interesting that like you said, we are still talking about this in this day and age when it shouldn't be happening. It shouldn't be happening at all. How do you think, Laura, and you, of course, as a documentary filmmaker, I'm sure you've documented stories, not necessarily like this, but of vulnerable people going through problems that shouldn't be happening in the 21st century. How does it make you feel as a journalist if you have to still be working on some of these stories?
Obviously, it's challenging and obviously it's hard. but I understand the privilege that I have to a certain degree. I mean, being a woman in media and film is already a bit of a challenge because of the nature of the industry. It's obviously really hard, but I see it as a responsibility to give voice to others. And it is seeing other people suffering that fuels that. And if they can't speak for themselves, or if they don't have the tools or the resources, and I do, why would I choose not? Despite, even if it's challenging for me. It's a choice, and these stories are the fuel that light that fire to
Right.
continue telling it. There's
Right.
just no other option. That's what it feels like to me. There's
Right.
no other option.
Right. So let's go see Dr. Naveen Rao taking his Lifetime Award yesterday and how he dedicated that award. And then we'll get back into the studio and continue our conversation.
I dedicate this award to all the frontline healthcare workers who do so much with so little, day in and day out. They are the true heroes of this story. Thank you.
Right. They, of course, are the true heroes. Again, and I know I've asked you how the feeling was already, but watching this again on the screen, it's all playing back, I guess.
Yes, because all that seemed to have happened in a flash. And I'm glad I said what I said, because it is true. The frontline healthcare workers, quite a lot of them who are not paid, do so much with so little, day in and day out. And it's a thankless job, but they do it. And they're the true heroes. It's easy for us to sit and talk about it, but at 2 in the morning when you have to go save a woman or work while she's delivering a baby and you have there's no electricity, there's no water, there's no medicine, but yet you're out there putting out your best. I mean, that is the human spirit. That is what we need to tap into. We are capable of that as humans.
Right.
We're also capable of the most violent atrocities, and so we have both sides in us. But when you have that and you need to celebrate, you need to be able to thank and help and support what is really good in us. And those frontline healthcare workers, I think, exemplify what's good in us.
Right. It's amazing you speak about this. Recently, I traveled with a few community health nurses in Ghana to a place to deliver vaccines. And so about 10 island communities in a place where they had to get onto a boat to cross about 2 different rivers to get to these communities. And the Ghana Health Service doesn't have speedboats. And so they need to get to the riverbank and wait the whole day because the boat goes onto the island once every day. And so you don't have to miss it and you don't know when it's going to come. So we had to stay there all day, wait, and then get onto the boat with about 100 women who were carrying fish to the market, and then get into the community. When we were ready to come back, the boat owner says he won't come back. And they had to stay there with no sleeping plans, anything. And this is where they had to go through just to get vaccines to save children. And so, yes, I agree with you when you speak about the heroes who usually are not spoken about at such platforms. And so, yeah, it's true. But also at today's plenary session, we also heard from Tina Chen, who is the former chief of staff to Michelle Obama, former U.S. First Lady and co-founder of Time's Up Legal Defense Fund. Listen to her important call to action.
I've been at this a long time, so I've seen a lot of things come and go. Elections won and lost. You know, the Equal Rights Amendment was the first thing I worked on 40 years ago in Illinois. We lost, except that we just ratified it 40 years later. So you have to, pick up. I have to say, not to end sort of on a downer, I am the most afraid right now that I have been in my entire adult life. I mean, I want to convey a sense of urgency today. This, you don't often know that you're living in a historical change moment. We know we are in one now.
Yes.
And there are 2 pathways that this can go, and one is really dark. And so this is the moment. If you ask where's the lowest, I have to say, for coming out of the Obama administration, I'm still here. right at the lowest moment, because we are really at a crossroads. And we have got to all redouble our efforts, the whole, put everything else aside. This is the moment of your life. You will look back when you have grandchildren, and they will ask you, where were you right now at this moment, 19 and 20, 2019, 2020, going into that, when the world changed?
Yeah, where were
in
you?
one way or the other. This is it. This is the moment.
How powerful. This is the moment. And I know, I mean, there's so many things happening now, which sometimes makes you wonder what tomorrow will bring, because you're never sure what is going to happen. Technology taking over everything, social media, we don't know what is going on. The world is really going to look like tomorrow. And Kumba, you are a young person in media and all of that. How does this statement, how does it prick you? How do you receive something like this?
I feel like I relate to what she's saying so much, and it is so true. A lot of the decisions that are being made by people who it won't really affect them. I'm the sort of person, me and my peers will be most affected by the decisions that are made now. And I stand strongly by what she said. I believe that everyone now should be very, very aware of what is going on, because we are in historical times, and everything that happens now will affect the younger generation. And I feel like that's why everyone needs to be aware and pay attention to what you're choosing to do.
Historical times indeed. Thembisa, we are just wrapping up now. She says this is the moment. We really need, everyone needs to play his part. What are we doing? What do you think we should do?
Well, first of all, we should vote.
Very important.
Yeah, and educate ourselves about the global politics. And importantly, all of us must embrace a cause. It will be, for me, it's a crime not to live without a cause.
Right.
We have to embrace a cause, and a cause that will advance, the betterment of humanity. And this is it. Because she's right. We're in trouble.
Good. Yeah, it's true. It's true. It's true. Dr. Rao, what are we doing? What should we be doing?
We have to understand, what we should be doing is come to the realization that we're all just one big family, and we are more connected than we think we are, and we cannot sit back and presume things happening in one country or one community, one race, one gender has nothing to do with us because they don't look like us or believe in who we believe in, or that we're all interconnected. Either we will sink together or we'll swim together. And we need to come to that realization that we are not going to swim while we allow others to sink.
Right. Very powerful. Laura?
He took the words out of my mouth. I was going to say, I think it centers around this idea of the recognition of our oneness, of the oneness of humanity at a very deep level. That if, one of the fingers of a hand is hurt, the whole hand is hurt. And I think humanity's in a stage of, you could say, adolescence, where we're trying to figure ourselves out and we're coming of age and we're kind of rebelling and we're headed towards maturity. So that from a bird's eye view, I think if we see that we are coming of age, and that gives us hope, because it feels like we're regressing, but we're also progressing. So to just be part, as you said, of any cause, whether you're an individual, a community, an institution, everyone has a part to play. Everyone must play a part, and recognize that oneness, promote that oneness.
Everyone has a part to play. And so you, watching us from wherever you are in the world, what would be your role and what would you do in this very historic moment? It's been an amazing week, as I started off by saying. And Vancouver, oh my God, it's one of the most beautiful cities I've ever been to. And I'm going to live with the memories of this last week, I'm sure, forever. Thank you very much, all of you guys, for sharing this moment with me. And my name is Justice Baidoo, and thanks for watching The Takeaway.